Here is a voiceover for Down syndrome. I wanted to focus just on Down syndrome a little bit more as we will be working with children with Down syndrome in our community clinic or in our Down syndrome clinic. Down syndrome is one of the most common genetic conditions that are out there, and surely if any of you work with peds, you probably will work with somebody with Down syndrome at some point in your career. And even if you don't work with somebody with peds, work with somebody in peds with Down syndrome, you may be working with some adults with Down syndrome, or you may even know or have some friends that have Down syndrome. This website down here is just a little reflection. Feel free to watch it. It's just a little YouTube clip on different faces of Down syndrome. It's kind of cute and gives you some pictures to look at. Down syndrome, again, is the most common type of chromosomal abnormality, and whether you know it or not, and this was news to me when I first started looking at Down syndrome, but there are actually 3 different types of Down syndrome, and when you get a diagnosis from the doctor or a referral from the doctor that says OT, Val, and treat, child has Down syndrome, they don't tell you what type it is. They don't tell you if it's non-disjunction or translocation or mosaicism. It's just Down syndrome. So just to kind of give you an overview, Down syndrome, as we know, is where they have an extra chromosome, okay? And so all of 3 of these different types of Down syndrome end up with an extra chromosome in some way, shape, or form. So the YouTube video is actually on non-disjunction, where it's a really, really nice video. Please take the time to copy and paste it into your web browser and watch it, because it gives you a really good visual on how these cells divide typically, and then it talks about how a non-disjunction would divide, where you end up with 2 chromosomes in one cell and then 0 chromosomes in the other cell. And with Down syndrome, we're looking specifically at chromosome 21. Translocation, part of chromosome 21 is broken, so there's only part of it that's broken, or it attaches to another chromosome. So again, when you watch that video, hopefully that makes sense on how that could occur. Mosaicism is one side of the division is accurate, and the other side just has that extra chromosome. Okay, so in the difference between non-disjunction is one side has 0 chromosomes, where mosaicism, one side still has the 2 chromosomes, but for some reason there is just an extra chromosome in that other cell. So again, I think that'll make more sense once you watch that YouTube video on typical cell division and what occurs in non-disjunction cell division. Down syndrome occurs again when there's that extra 21st chromosome, and typically we all have 46 chromosomes, but since there is an extra 21st chromosome, somebody with Down syndrome actually will have 47 chromosomes. There's higher incidence on children who are born to women over the age of 35, so the older the mother is, the higher incidence or the more likely chance that the child could be born with Down syndrome. And Down syndrome is as common as 1 out of every 800 live births, so we probably all know somebody or came across somebody at some point in our life who has Down syndrome. Down syndrome is more common in boys than in girls. The average life expectancy of somebody with Down syndrome is only 55 years of age, and we'll get into why that is perhaps later on. Certainly people live longer than that with Down syndrome. I've worked with individuals in skilled nursing facilities that have Down syndrome. I've seen people with Down syndrome in the hospital because maybe they've had a fracture or a car accident or something along those lines as well. Initial treatment for a child includes just following regular medical checkups and doing those well baby checks. Maybe some speech and language therapy because you may see some speech delay. Physical and occupational therapy, typically children with Down syndrome present with lower muscle tone. There also may be some feeding issues at first as well. So you're going to want those regular medical checkups to be checking the baby's vital signs, the weight, some of the reflexes, some of those types of things. And then also initial treatment may include counseling for parents. It may include genetic counseling to see if they have other children. Are they likely to have more children with Down syndrome? Is it just how to cope with a child with a diagnosis? Because parents will go through kind of a grieving process because they've wanted a typical child and they have all these hopes and dreams and aspirations for their children. However, then when that child comes and there's a disability, sometimes they think the worst. And so sometimes they need that counseling. Some of the physical characteristics of an individual with Down syndrome include typically being of shorter stature. They may have a smaller nose and have more of a flatter facial profile. Something I think that really stands out is the upward slant to the eyes. You may see smaller hands and shorter fingers, which could impact their fine motor abilities, their grasping abilities. They may have a simian crease. A simian crease is one line that runs across the palm of your hand, and most of us have 3 distinct lines in our hands. So again, if it's just one line, that one line is called a simian crease. They may have a smaller mouth and a larger tongue, which is why it kind of presents as feeding issues as a newborn baby. And they may have extra space between the big toe and the second toe, which I've never really noticed before in anybody with Down syndrome, to be honest with you. And kind of a big area is you will see some hypotonia. Behavioral characteristics, you will see kids with Down syndrome that are very, very impulsive. They may be inattentive to social cues. Typically, when you see these behaviors, if you can structure a routine and keep things structured and keep things as black and white as possible, it tends to decrease those behaviors. Other associated health complications, and this is why I think we see a lower prognosis at that 55 years of age. You can see some intellectual impairment, or you could still hear the term mental retardation, as much as I hate it. And that can vary from mild to severe. Typically, somebody with Down syndrome doesn't have the profound intellectual impairment. It's more of the mild to severe intellectual disability. You see a lot of heart defects, more so to where you will see newborn babies that have heart surgery, open heart surgery right away. They sometimes have a hole in their heart or a heart murmur that needs to be surgically fixed. And some of those complications can be picked up via ultrasound now, even in utero, so the parents can prepare for that ahead of time. You'll see some thyroid diseases, and some of those thyroid diseases contribute to some obesity, some weight gain. You see frequent infections, some respiratory problems. You may see digestive problems. There's a higher incidence with individuals with Down syndrome when they reach an older age that have Alzheimer's disease. And I've seen a couple people with Down syndrome that have Alzheimer's disease. They were on our Alzheimer's unit. Again, you'll see that abnormal weight gain, possibly due to thyroid disease. It could be because of intellectual impairment and not preparing adequate food or nutritious diets. You'll see poor muscle strength, which could be due to low tone. You'll see weak ligaments. And you may see hearing and or vision problems also. And those vision and hearing problems can result in speech problems. So if you have a child who can't see and can't hear, that's going to affect their ability to hear proper speech sounds, or to see what it is that people are referring to. And so it's very common for people that have even a lot of ear infections as an infant to present with speech delay. Getting back to weak ligaments, something that we really want to be careful about with individuals with Down syndrome and to keep in mind is in their neck, looking specifically at their atlas and axis cervical bones, those are held together by ligaments. And if their ligaments are weak, that means that there's a lot of give and a lot of flexibility in their joints. Looking again at the atlas and axis, why that is so dangerous is because the spinal cord runs through the atlas and axis. And so if the ligaments aren't keeping that structurally sound, if you have a kid with Down syndrome that maybe flexes their head or gets in a car accident or something like that, that could really compress the spinal cord. And so I worked with a kid that had Down syndrome, and his parent was a coach, very, very athletic, very big into athletics. Of course, when they had the child with Down syndrome, they were devastated because it was his little football player and that sort of thing. And the father was like, okay, it doesn't, just because my child has Down syndrome doesn't mean that he still can't be active. So when he was little, they got him involved in gymnastics. And they brought him to OT to look at fine motor and hand skills because, gross motor-wise, this kid could run laps around anybody. Didn't seem to have poor muscle strength. But he would run in our hallway down our rehab clinic, and he would start to, do tumbles and stuff, like somersaults. And I gasped because I remembered this atlas and axis instability, and I thought, oh my gosh. And so I asked if they have ever gotten him checked out, and the dad just looked completely ashen white and said, oh my god, I've never heard of this before, are you kidding me? And so they went in and they got him x-rays of his neck, and he did not have the atlas axis instability. But they were thankful that somebody brought it to their attention and that they got it checked out because he was such an active, roughhouser little guy. And of course, they had such high hopes for him, and he was doing very well physically. So typically, the atlas axis instability, and that just means that it's kind of loosey-goosey, it's not held tightly by the ligaments, only occurs in 10 to 30% of individuals with Down syndrome. So again, the atlas axis instability only occurs in about 10 to 30% of individuals with Down syndrome. So not a lot, but still 30% to 10%, that's kind of a lot of leeway there, I think. I'm not really satisfied with 10 to 30%. I think they should get more specific with that, especially since it could mean compressing the spinal cord, and then you have a child with Down syndrome with a spinal cord injury. Not that I know anybody with Down syndrome that's ever happened to, but it could happen. Looking specifically, again, at fine motor development in Down syndrome, so you may see some shorter limbs. You may see shorter, stubbier fingers, okay, and wider hands, and they don't have the creases in their hands, okay? They may have that simian crease, which is only that single crease. So there's a wide variety of characteristics associated with Down syndrome that can affect the fine motor skill development. And what do we use our hands for? We use our hands for everything, so of course it's going to impact their occupational performance. So you may see some overall hypotonia. So when you look at their hands, how is the musculature of their hands? Does it look like it's low tone? Okay, get in there and feel their hands. Does it feel like it's low tone? That takes practice to feel that. How are their ligaments in joint laxity? So we talked about atlas and axis with instability. Okay, your MCPs, your MPs, your DIPs, your PIPs, your wrist, they all have ligaments. And so if your ligaments are loosey-goosey and your joints have laxity to them, that's going to affect their ability to hold a pencil. It's going to affect their ability to pick up small beads or to pick up or to do different dressing fasteners. Having shorter limbs makes it harder for them to reach. So it's going to be harder for them to reach behind their back to don a coat, or they may have to bend at their waist to pull up their pants because their arms aren't long enough. Or same things with putting items up on the counter. They may not be able to reach to get a drink of water. And again, looking at the hand characteristics, if they only have one hand crease, they may have a difficult time with that in-hand manipulation, okay? The palm to finger, the finger to palm, the shifting, the simple rotation. Some of those types of in-hand manipulation skills may be affected. So knowing that about fine motor skills, hopefully we have an assessment in the back of our mind, working with children birth to 5 or birth to 6, looking at motor skills, hand-eye coordination or visual motor integration, and grasping skills that might stand out to you, that would look specifically at these motor skills, aka Peabody. Gross motor development in Down syndrome, the skills acquire more slowly, but they still develop over time. Gross motor skills, which is GMS, gross motor skills, can eventually become one of their strengths. And again, it was with one of my clients that was doing gymnastic somersaults and cartwheels and running like crazy. He actually ran away from his babysitter, and they called... the babysitter called his mom to come home and to get him, and he wouldn't come out. He was hiding, and so the mom went outside and was looking like in one of their garden sheds, because he would sometimes like to go and hide in the garden shed. Well, he was in a tree, apparently, and he jumped down from the tree when the mom went in the garden shed, and he locked the mom in the garden shed, and then he went and he hid. And so the babysitter was inside looking for him. The mom was locked in the garden shed outside, and he was running around like nobody's business. So talk about spontaneity and impulsivity and lack of safety and behaviors and all those sorts of things. But again, gross motor was probably one of his strengths. Let's see, characteristics that can affect gross motor. So again, if a child does have the hypotonia, they do have the increased flexibility in the joints. And again, here I bring up the atlantoaxial instability in the neck again. So gross motor, you want to be very careful with gross motor in rough housing, especially you just want to make sure that atlantoaxial joint has been checked out. They may have decreased strength because of their hypotonia, and because of their short arm and leg stature, they may have some difficulty with gross motor skills. So how does that all affect occupational performances? And there are many performance areas to address. There's when I look at performance areas, I'm thinking of fine motor, I'm thinking of visual motor, I'm thinking of all the items that are on the Peabody, right? And all those hand skills, all those gross motor skills, they're going to affect self-care skills. So if you have the fine motor and visual motor issues, you're going to have trouble with buttoning. You're going to have trouble sustaining grasp on writing utensils. You're going to have trouble holding eating utensils. You're going to have trouble with handwriting. You're going to have trouble with finding gross motor skills. Okay, you're going to have trouble playing with Legos and blocks and doing puzzles. And doing some of the fine motor play. And if you have issues with gross motor, you're going to have trouble running and keeping up with your peers on the playground. You're going to have trouble climbing the ladders to the slide. Okay, so that's going to affect play and leisure skills. Looking specifically at school performance of cutting with the scissors. So the boy that I worked with Down syndrome had he had shorter fingers but wider hands. He had some weak grip strength. because of low muscle tone in his hands, so he had a really hard time cutting with the scissors. Plus, his safety and impulsivity made me a little nervous when he had a scissors, because there was a few times when he would chuck it at my head because of being frustrated with cutting with the scissors. Also, printing with handwriting and sustaining grasp on pencils can be really challenging. And pencils are narrow, and you think of instability with the PIP, DIP joints in the hand, and they have to hold on to that pencil super tight. So there's some things with different grip aids that may help them sustain grasp on a pencil and be a little bit kinder to their joints. So a lot of areas that are affected. In adults and later lifespan, the same skills are addressed, so there's still self-care skills, there's still fine motor, there's still gross motor, but we're looking at them in different contexts or in different situations. So we're looking at all those skills, those fine motor skills, in vocational training. Okay, so is there any jobs that would be suitable for the individual? Is there anything we can do to train them or to increase their skills on the job? Again, with their impulsivity, we need to look at some social skills training as well. How are they interacting socially? There was a lady that was working at Hallmark, the card store in the mall, someplace in the state of North Dakota, and she had Down syndrome, and she was talking really, really, really loudly about some of her personal problems, some of her personal issues with transportation, because her mom drops her off at work and comes and picks her up, and she was having issues and complaining that her mom was running late, and she was letting the whole entire store know. So that's it was funny and it was cute and stuff like that, but socially it probably wasn't the most appropriate to have her going around talking to the customers that way. And if anybody knows her, I did not use her as an example in this PowerPoint. So money management and paying bills, they may need some help with that. Again, if they have those intellectual disabilities, we talked earlier about some of those skills in dealing with money, dealing with numbers. Those sorts of things would be very difficult. Nutritional counseling as well, because they may not have the intellectual functioning to know or to pick out nutritious meals. Again, transportation, perhaps they have to use public transportation. Perhaps they have to rely on a friend for transportation. So we would look at that with them. We'd also look at skills related to maintaining a household. So are they able to sweep their floor or do cleaning or do laundry or do cooking or do yard work? I mean, are they able to do some of those skills? And we would observe that and we would assess that and we would probably make some recommendations. Again, because there's typically intellectual disability that's associated with Down syndrome, our job may be to recommend appropriate supports in some of these particular areas.